In a bid to improve access to quality health care services, residents of Kainamfumu in Kifubwa ward of Solwezi district are spending long time in queues to receive health care services due to low staffing levels brought by the lack of staff accommodation at the facility. Despite the availability of this only facility in the area, with a population of over 4,500, the facility only has one staff house. Now, the community is supplementing government efforts to improve the status quo by implementing a community-led initiative aimed at constructing a staff house at the facility. This two-bedroomed house is being built using locally generated funds, materials and labor. John Kamwanga is a community member and narrates how the project was born and progressing.
We decided to mobilize ourselves to build a staff house for an employee who was squatting in a teacher's house. We were contributing 300 kwacha per household in all sections for purchasing of cement, sand, and while we molded bricks ourselves.
Community members seeking health care services at the only facility in the area share their experiences of not having adequate personnel at the facility.
I came here at 11 hours to seek medical services, and I was only attended to around 15 hours.
We have very few workers at this facility. One officer is not enough to cater for the community. We are asking the government to bring us more workers.
Actually, we are a bridge between our community members and the government wings. We bridge the gap so that we share the information, we get information from the community members on what they want to see. We take it to the decision makers who can now channel the resources to implement various projects. When people take the lead, meaning they'll come and give more support to that project. And in certain cases, we've seen certain community members, in the interest of the community, they've ended up even sacrificing their personal properties or personal resources just to make sure that that project gets to be implemented. Certain people have gone to an extent of even releasing certain piece of land if the project that is needed maybe requires some piece of land to put up that project. That is community engagement as well, community encouragement. We agree and want to continue on the trajectory of making sure that community members are brought closer so that they move hand in hand with its government.
Northwestern Provincial Health Director Lakson Chidikita has applauded the community initiative and has pledged government support in completing the project in time.
We value that partnership, and my administration here, we want to make sure that we take this partnership to another level with our community participation, community cooperation, community involvement is the cornerstone of any development in as far as governance is concerned. And we are happy in Northwestern Province, particularly in my Department of Health, that we are receiving a lot of that support from our communities, and that's why we are making some good strides.
This community initiative provides a solution to how community problems can be solved and serves as an example to other communities facing similar challenges. Dominic Bikane, ZNBC News, in Solwezi.